Hi, today I want to talk to you about your thyroid and why you may be suffering with symptoms even though your lab tests show that your thyroid is functioning normal. Hi, my name is Dr. Brad Morris. I am a board certified chiropractic physician. I've been in practice for over 15 years. I've been studying functional medicine over the last 8 years, and that's what's led me to study the thyroid. I also suffer from Hashimoto's, so I can relate to a lot of people that have thyroid problems. All chronic health conditions have some common threads. The thyroid condition, type 2 diabetes, insulin resistance, fibromyalgia, vertigo, chronic fatigue syndrome, peripheral neuropathy, chronic neck and back pain, irritable bowel syndrome, stenosis, insomnia, Crohn's disease, celiac disease, PCOS, infertility, migraine headaches, Hashimoto's, ADD, and ADHD. All those things have a common thread with metabolic imbalances as well as neurological imbalances. Metabolic imbalances are things like anemia, thyroid dysfunction, unstable blood sugar, adrenal gland dysfunction, hormonal imbalances, autoimmune attacks, and hidden infections. May it be in the gut or it may be a viral infection. You may also be suffering from food sensitivities or chronic inflammation. All these things are going to relate back to those symptoms that we talked about previously. Some neurological imbalances would be a decrease in firing in the brain. It's basically brain fatigue. All cases are a combination of neurologic and metabolic management. The first thing is metabolism. So we eat food and we're hoping to get energy. But where does this energy go? Well, 30% of it goes to our nervous system, the brain, the spinal cord, and the nerves. And we need a proper functioning thyroid for this metabolism or this energy and for a well-functioning brain. The thyroid does have a direct brain connection. So some thyroid symptoms that you may be having are fatigue, increase in weight gain even with a low-calorie diet, morning headaches that wear off as the day progresses, depression, constipation, overly sensitive to cold weather, poor circulation, numbness in the hands and feet, muscle cramps while at rest. You may catch colds easily, either from a virus or a bacteria. You may get a wound that heals very slowly. You may require excessive amounts of sleep to function properly. Chronic digestive problems, itchy or dry skin, dry or brittle hair. Your hair may be even falling out. You may even notice some edema, especially in the face. And you may have a loss of outside portion of your eyebrows. So the lateral 1/3 of the eyebrows, you may have noticed have started to disappear if you've been suffering with some thyroid problems. The way to support the thyroid, though, is with bone metabolism. You got to support the immune system. Of course, the brain and nervous system. We have to look at the endocrine system as well as the gastrointestinal function. Liver, gallbladder, growth, sex hormones, fat burning, healthy cholesterol levels, and proper stomach acids. Every cell in your body has a thyroid receptor, so that's why there's so many things we have to look at. In addition, the thyroid is going to have crosstalk with some systems. So the immune system, the gut, the brain, and the endocrine system are all going to give information back to the thyroid. So if it's not functioning properly, the thyroid can't get the information from these systems, therefore it can't send the correct information back to the system so you can have proper function. So the way that the actual thyroid works is it starts in the hypothalamus. The brain's going to release what's called thyroid releasing hormone, and it's going to release that to the pituitary gland. Now that pituitary gland has two portions. It's got a posterior and an anterior portion. The posterior portion is going to control hormones, so no surprise that we're having some problems with hormones when our thyroid's being affected. But the anterior portion of that pituitary gland is going to release TSH, or thyroid stimulating hormone, and that's going to stimulate the thyroid gland. Okay, and that thyroid gland is going to release T4 and T3. Now, T4 is the inactive form of the receptor, and we're getting 93% of that released from that thyroid gland. T3 is the active form, and that's what all your cells need, is the T3. Unfortunately, only 7% is produced from the thyroid gland as T3. So we have to be able to get that T4 and get it converted to T3. And we do that via thyroid binding globulin, and it's basically the taxi cab over to our liver, our gut, and our extremities. Now, 60% of that conversion happens in the liver, while the gut and the peripheral extremities are only getting 20%. And we're using minerals to get that T4 into the liver and convert it to T3. So there could be a number of problems going on there that would prevent that thyroid from functioning properly. So it's just not only the thyroid. We could have a problem getting it to the liver. We could have a problem with minerals, so we could be having difficulty converting it. Maybe it's the pituitary gland. Poor liver function would, of course, affect the way that the conversion is going to happen from T4 to T3 as well. Poor gut flora is going to cause a poor conversion from T4 to T3. The small percentage of T4 actually goes back to reverse T3, which is going to be another marker that we look at to see how that thyroid is functioning. So have you been told your lab tests are all normal? The lab ranges are inaccurate, and it's because bell curves are used. Functional lab values are more sensitive to reveal the problems. And that's why people are missing what's really going on with the lab. So a normal lab range may be quite broad. Maybe it's 0.5 to 5.0 on a TSH range. Functional lab values are much smaller. They're squeezed down. Functional lab value for TSH, for instance, is 1.8 to 3.0. So it's much closer, and you can start to see problems before they've actually become pathological. And that's what we're seeing in conventional lab tests. Some other ones are like glucose. If you look at your glucose on your lab test, it may read 65 to 110. It's a very broad range, whereas a functional lab value would be 85 to 100. Triglycerides is another one. Less than 150 is a traditional lab range. Optimally, a functional range would be 75 to 100. So we want to look at these lab values and see really where are they at so that we can determine what's going on with the thyroid. So a true thyroid functional test will of course include the TSH, and that's usually what's conventionally ordered. Most of the time we only see the TSH. Occasionally someone will order a T4 to go along with that. But optimally we need to look at the TSH, the total T4, the free thyroxine index, it's hard to say all together, and that's really the amount of T4 that's available. There's also the free T4, and that's what's being affected by prescription drugs, is that free T4. There's T3 uptake, how much of the T3 is being taken up by the TBG. So remember that taxi gap I talked about, that thyroid binding globulin has to pick up and use part of that T3 for the cells. There's free T3, and that's actually the active thyroid hormone. That's what all the receptors are looking for and wanting, is that free T3. The reverse T3 is the T3 that the body cannot use. And then there's TPO and TG antibodies. And these antibodies, they're going to tell us, is this an autoimmune disorder or is it Hashimoto's thyroiditis? That's an autoimmune attack on the thyroid receptors. The other is a TSI antibody, and that's going to determine Graves' disease, which is the opposite of hypothyroid. So when we're looking at hyperthyroid, it can go into Graves' disease, and that's the antibodies to actually diagnose is it a Graves' disease problem. And then the last thing we're going to check are the TBG levels, and again, that's that taxi cab. So the typical test order that we see again is TSH and total T4. So how can you manage your health without all the information? Burning out the thyroid gland with hormone replacement is a 50-year-old model. In order to manage your health, you're going to need to look at the causes of the problem, not just the symptoms. So Hashimoto's thyroiditis or hypothyroid and Graves' disease, these are not thyroid problems. Your immune system is mistakenly attacking the TPO or the TBG or the TSI and Graves' disease. It's an immune problem. There's an imbalance in your immune system that needs to be addressed. And the only way to do that is with proper testing. So conventionally they're treating it with levothyroxine or Synthroid or some type of support for the thyroid gland, but the bottom line is it's not the thyroid's problem, it's not the thyroid's fault. It's actually an immune system problem. So, got to find out what's going on there. Now, that immune system has three parts. Number one is the natural barriers. Your skin is for one, your lungs are another, your eyes, the mucus that you get is another part of your immune system, and then finally the gut flora. Now, Th1 and Th2 are your white blood cells that are going to help fight off these attacks. Their Th1 is a cell-mediated or innate immune response. These cells are the front line of defense against any antigen. So when something comes into our body that's foreign, they're going to go after it and try to get rid of it. The second line is Th2, or the humoral immune response, and this is an adaptive immune response. These cells tag the invader with antibodies for a more efficient immune response if exposed again. So one example would be vaccines. So you take a vaccine, you're going to be exposed to that, and now we're going to get a humoral immune response so that any antigens that look like whatever that vaccination was given for. And then the third part about it is your TH3, the regulatory T cells. This balances the communication between Th1 and Th2. In most autoimmune patients, Th3 is failing, therefore Th1 and Th2 become out of balance. So we got to have Th1 and Th2 equally balanced, and Th3 is the one in the middle keeping that in order to have a proper functioning immune system. Okay, so autoimmune disease is when the body is actually attacking itself. That Th1 and Th2 system is out of balance. There's two responses in your immune system. It's the Th1 and Th2 response. When a patient is autoimmune, one of these systems is hyperfiring or dominant. And balancing the system goes far in reducing a patient's symptoms. So what could trigger an immune system to do this? Well, there's a number of things. One, chronic inflammation from poor diet, bad blood sugar, bad adrenal glands, hormone imbalances, neurological imbalances, pregnancy, low vitamin D, increased acidity in the blood. Some other things are chronic infections like bacterial, viral, mold, infections in the gut, food sensitivities, environmental toxins, or leaky gut syndrome, also known as intestinal impermeability. So the only way to treat these things are to actually do the proper testing to find out what is causing the problem. So it all boils down to what is the cause. Okay. So the management and support for Hashimoto's or Graves' disease is number one, you got to remove the antigen or the cause of the dysregulation or dysfunction. Okay. Then we must modulate the immune system so that it'll function normal again. How do we do that? Well, first of all, we have to get vitamin D. Got to get that balance going in between the Th1 and Th2 systems. And the other things we use are things like glutathione, nitric balance, fish oils. We remove the stimulants that to the dominant half of the immune system and support the non-dominant half. And we also use a number of herbal compounds to treat these things. Bottom line though, we don't know what to do until we have the proper testing so we know what we're going after. There's actually 6 major thyroid patterns associated with the thyroid. I've talked a lot about Hashimoto's being the autoimmune portion of it, but there's 6 other major thyroid patterns that you may be having. Number one, of course, is going to be primary hypothyroid. The second is hypothyroidism secondary to a hypopituitary. So there's something going on with the pituitary gland that's causing the thyroid to act like it's a hypothyroid. The third thing is the thyroid may be underconverting. There may be a decrease in TBG. The fifth is TBG could be elevated from, say, contraceptives or hormone replacement therapy. And then thyroid resistance is the last. So we'll talk about primary thyroidism first. The thyroid gland gets lazy and the pituitary gland tries to kick it in the pants by pumping it up with the extra TSH. So that's why you'll see a high TSH with primary hypothyroidism. Only pattern of the 6 that we talked about that need hormone replacement. Hashimoto's may need it too just because it may need that extra support, but of the 6 patterns, primary hypothyroidism is the one that is going to need that levothyroxine or that Synthroid. Nutritional support, if caught early, can actually reverse the problem. So you can use some porcine thyroid glands. Ashwagandha is a good one, vitamin A, vitamin D, selenium, zinc. All those are going to support that thyroid. And then to support the conversion from T4 to T3, we use things like antiperoxidative compounds or Gugaloo. The second type that we're going to talk about is hypothyroidism secondary to the pituitary. So now instead, the pituitary actually gets lazy, and that's a low TSH, below 1.8. Okay? So chronic stress fatigues the gland. Hormone pills, including Synthroid, can affect the pituitary gland. Creams from estrogen, postpartum depression, pregnancy can fatigue the pituitary gland. Fluctuating insulin and glucose levels, or adrenal gland fatigue. So all those things are going to affect the way that pituitary gland works as well. And again, some nutritional support to bring that back up are things like the porcine thyroid or pituitary gland, rubidium sulfate, sage leaf extract, L-arginine, gamma orzanol, magnesium, zinc, and manganese are all good nutrients for the pituitary gland. Okay. The third thing we're going to talk about is the thyroid underconversion, or I should say the third pattern. The gland is making enough T4, but there's a decrease in conversion from T4 to the active form of T3, so low T3. So why does that happen? Most commonly is going to be chronic adrenal stress due to increased cortisol. What happens is that suppresses the T4 to T3 conversion. So why do we get increased cortisol? Well, it's our stress coping mechanism. So anytime we're under a lot of stress, that's going to cause adrenal stress. We may have a chronic infection or a chronic inflammation. Those are two big things that would cause a conversion issue. And it's often missed because low T3 doesn't affect the TSH, only T4. So T3 is rarely checked with the blood test, so it's just getting missed regularly. Some nutritional support for that conversion is glutathione cream, and that's going to reduce inflammation. Phosphatidylserine cream, and that's going to support the adrenal glands. And then there's compounds that will support T4 to T3 conversion. And there's selenium, zinc, and all the anti-peroxidative compounds. The fourth pattern is the overconversion and decreased thyroid binding globulin. Too much active T3 is made, and it's overwhelming to the cells. And little TBG, which means too much free T3. So there's too much T3 floating around in the bloodstream in your body. And the reason this happens is the number one cause actually is insulin resistance. And that's more predominant in the females as well. The cells are not listening to the insulin, so more insulin is being secreted. This also increases testosterone levels in females, resulting in too much free T3 and too little TBG, or thyroid binding globulin. So now we have an overconversion with too little TBG, and remember that's that taxi cab. Nutritional support that goes along with that is, number one, you got to stabilize the blood sugar. So the insulin has to be stabilized via the diet and nutritional compounds. There's a number of things that need to be changed in diet in order to get that blood sugar under control, and everybody's individual. So some things are affecting some people and other things are affecting other people. There's no cookie cutter method to getting that blood sugar stabilized. So you really got to do the proper testing, identify what the problem is, and then identify what foods are affecting each person. The fifth pattern of the thyroid is the thyroid binding globulin elevation. So too much TBG in the blood and thus too little free T3. This happens because of oral contraceptives or estrogen replacement therapy. It causes an increase, which leads to an increase in the TBG. Okay, some support that you can do there is choline, beetroot, betaine, HCl, milk thistle, dandelion root, glutathione, vitamin C, and phosphatidylcholine. The sixth thing that we talk about, the sixth pattern I should say, is thyroid resistance. Now, pituitary and thyroid glands are fine, and so the hormone levels, however, the hormones aren't getting into the cell. Let me say that again. The pituitary and the thyroid gland are fine. So are the hormone levels. So everything's functioning fine, but we can't get the hormone into the cell. I know that sounds confusing. Chronic stress with stimulants from the adrenal glands to produce too much cortisol, which causes cells to be resistant to the thyroid, is the cause of the problem. So again, stress is the main culprit affecting this thyroid gland and its function. Some things that we can do to correct that is, number one, you have to address the adrenal malfunction. And it's going to help you cope with the stress probably the most effectively. So if you go after the adrenal glands, you're going to fix the thyroid resistance. So again, it's not the thyroid's problem, it was a problem going on with the adrenal gland. So anytime there's a thyroid dysfunction, it is a sign of a metabolic problem as well. So that's why proper testing is so crucial. Some of the tests that are absolute, a must, would be a comprehensive metabolic panel. Vitamin D levels. We've got to be able to check for anemia. We've got to check the kidneys. We want to look at hormones. So what does the estrogen or progesterone or testosterone numbers look like? There's also tests for leaky gut syndrome. Are we sensitive to gluten? Are we sensitive to soy or yeast or eggs? So we need to find out what foods are really bothering your body. And then we got to look at what's going on in the gut. Are there any gut infections? Are there parasites? Is it yeast? So we got to find out, is there any candida overgrowth? So really crucial that we get the proper test done to find out what's going on with each individual. So back to Hashimoto's, there's actually a triad of problems associated with Hashimoto's. Number one, the antibodies. So if you have antibodies to TPO or TG, it's Hashimoto's thyroiditis. What goes along with that is going to be a gluten sensitivity. We see it in every one of the Hashimoto patients that we treat. We also have these antibodies to intrinsic factor, which leads to a lower B12, which will lead to pernicious anemia. So we're also going to have some fatigue and anemia to go along with that. The antibodies to the TPO, the next thing that's going to happen is the pancreas. The pancreas is not going to produce the insulin like it's supposed to, so now we've got to start worrying about blood sugar problems. And then that's going to cause problems with the myelin sheath, aka peripheral neuropathy. And then it's going to affect the cerebellum. So now we're starting to get brain fog and can't figure out why we're starting to leave things in rooms and why did we come into that room? What are we looking for? So we get brain fog and forgetfulness. And it's not related to age. It's a problem with the way that things are functioning. It's not something as we get older. So what makes our office different is what we do is we're going to manage and support patients neurologically and metabolically. And I'm here to tell you that we don't leave any stone left unturned. We want to find the exact cause of your condition. With functional medicine, we are going to base our lab findings on a functional lab value so that we can determine what nutritional products you may need to fix these biomechanical pathways to get to proper healing. We also want to look at your gut, your thyroid, and your adrenals, the liver and the biliary system. We want to check for anemia, sugar regulation, autoimmune regulation. So first and foremost, we're going to do a comprehensive neurological and metabolic workup. The neurological test consists of blood pressure, tissue oxygen saturation, heart rate rhythm, reflexes, eye test, cranial nerve test, the cerebellar test. And then the metabolic tests that we do are going to be, of course, blood sugar levels, adrenal function, cortisol levels, thyroid hormones, cerebellar antibodies, thyroid antibodies, female hormone panels, and then we want to know what's going on with that GI system. Is there any leaky gut syndrome? So we want to do an intestinal permeability test. And then of course we're going to run immune panels to make sure that the immune system is functioning normally. So 30% of this energy that we get from our foods is going to go to that brain, so it's pretty important that we look at the most common problems. So the most common problems that we see neurologically are going to be abnormal sensations, abnormal movements, abnormal cognition or thinking, and abnormal posture. Remember, the brain is the brake pedal, so 70% of the brain is the brake pedal. So anytime we're having a problem where we can't stop, then we know that brain's involved. So weakness in one area is an increased firing in other areas. So we got to determine, is there a weakness and is that what's causing an overfunction in another area of the brain? And that may be affecting that thyroid as well. So the two areas that need to be inhibited the most are going to be the sympathetic nervous system. That's your fight or flight. What that means is anytime you are scared or need to run, your sympathetic nervous system kicks in automatically to get you out of that situation. And then the next system we need to look at is going to be the limbic system. And that's what's controlling your emotions. Okay? So some symptoms of sympathetic escape, and that's what we talked about, that fight or flight, are going to be things like headaches, sensitivity to light, sound, hormone imbalances, high blood pressure, poor digestion, frequent urination or urinary tract infections, poor sleep, cold hands, feet, chronic pain. All of those things are going to be related to that sympathetic nervous system. And then some symptoms of the limbic escape are going to be irritability or lack of focus, anxiety, OCD, depression, mood swings. The most active area in your brain is going to be your cerebellum. So anytime you feel clumsy or you have neck and back pain, vertigo, balance problems, or visual disturbances, you know that cerebellum is not firing like it's supposed to. And remember, if there's one area that's not firing like it's supposed to, there's another area that's overfiring. So we have that major imbalance again. So what can be done for those things is called brain-based therapy. The brain is just like a muscle. If you work it out, it will learn. That's the definition of neuroplasticity. the way that the brain stops functioning like it's supposed to, or we get these imbalances, is from things like chemical stress, physical stress, and emotional stress. They all cause the brain to fatigue, and when the brain's fatigued, we have fewer nerve impulses. And obviously, we're not going to get the information out to our body that we need if the brain's not functioning the way it's supposed to. Okay? So, some symptoms associated with a chemical and physical stress to the brain are going to be anemia. That's too little oxygen. Okay? There's blood sugar problems. So the glucose. The glucose can't get into the nerves, so that's why we see peripheral neuropathy with people that have sugar dysregulation. We have food sensitivities, maybe to gluten, to dairy, casein, soy. Immune system imbalances. Are we autoimmune? That can be related back to that brain again. Poor diet, inflammation, omega-6 and omega-3 fatty acids are all going to be stressful to that brain. Of course, hypothyroid function is going to be from a chemical and physical stress to the brain. Prescription and non-prescription drugs, those are both chemical stresses to the brain. And then chronic inflammation, hidden infections in the gut, both of those will cause stress to the brain. So what can be done? Well, the cerebellum and the brain require two things to function properly. One is fuel and the other is activation. Fuel comes in the form of glucose and oxygen. So how do we get glucose? Well, it's the food we eat. So we've got to make sure that we're giving our body proper nutrition. And then, of course, oxygen is the air we breathe. Activation, now, on the other hand, is movement. So any movement that you do is going to activate the way the brain works. So moving your arms or going out for a walk or exercising is all activation to the brain. That's why it's so good for you. What we do in our office is we do functional neurology treatment protocols to help restore that balance back to the brain. Some of the things include balance, posture exercises, auditory stimulation, visual tracking, light stimulation, olfactory stimulation. All those are going to affect the way that the brain functions. So we can, with those therapies, we can bring that brain back up to a normal balance. Adjusting the spine is going to affect the way that the brain works. Rhythm and timing exercises, proprioceptive exercises, and there's many, many more. But one of the biggest important things for the way the brain works, what do you feed it? You got to give it proper nutrition. So we want to make sure that we're feeding it and giving it as much nutrients that we possibly can, as well as much activation as we possibly can. So we get the brain to function normally, then we can look at all the pathways that have been destroyed or been inhibited or excited, and then we can go after those to get those corrected. So the main thing is to get the metabolic system and the neurological system to work together. So the cerebellum, the midbrain are going to play a huge role in stabilizing blood sugar and hormones and getting your cortisol under control. Remember, cortisol is that stress coping mechanism, but it's also toxic to the brain. So what we have to do is we have to do periodic, let me go back up. Once we get those things organized, we'll have to do retesting to make sure that you stay on track. But once you get them straightened out, then you can keep them on track quite easily. You're going to learn the proper systems, the proper foods to eat to take care of that. So the big thing is what do we got to do? We've got to bring all these pieces together to make sure that we manage the whole person, not just treat the thyroid, not just treat the pancreas. We want to make sure that we treat the whole body. Okay? So hopefully that gives you an insight of what's going on with your thyroid. My name is Dr. Brad Morris again, and thank you for listening.